This is a genuinely difficult question to address. There are a lot of vaccines that are currently being developed. I don't think I have exactly the latest figures, but approximately 2 weeks ago, I understand there were 34 vaccines that were undergoing clinical trials already. So this doesn't count the ones that are in development that have not reached that stage. But the difficulty is that we have no guarantee that any of these vaccines are going to work. Based on the information that's currently available, it's estimated the cost of one vaccine will be somewhere around $10. And what the aim is for all the countries that sign up to this kind of agreement is that they will get access to vaccine to cover 20% of their population. And so the initial 3% of that supply will probably be targeted towards healthcare workers and people who are, if you like, at greater risk of contracting infection, but for those people to stay at work and continue to deliver care is also really critical to supporting the COVID response. And then the 17% in addition to that are really the people who fall into the broader risk groups. So people who are older, people who may be overweight, people who have other medical problems that mean they're more likely to be infected and develop severe illness. I think what some countries are trying to do is to set up bilateral arrangements with another country or a specific vaccine manufacturer or one or two vaccine manufacturers. And although they may think that assures them a supply, then this does entail some risk because, again, like I said, there's no guarantee that any one vaccine is going to be successful. So, we think if countries participate in this initiative, then it's going to be a much better guarantee that they will have access to at least one vaccine that will be effective. And even after 20% of the population is vaccinated, unless there's more vaccine production, more availability of vaccine, those people will still be vulnerable. And although they may not be so likely to get severe illness, some of them will get unwell and some of them will be admitted to hospital. But also that group of 80% of people, if they don't continue to take measures to protect themselves, then they could just propagate the infection. So I think if people drop their guard once we start vaccinating, we could be in quite a difficult situation. The important message is that we need to carry on with these protective measures, at least for the duration of the COVID outbreak. But part of the new normal is that adopting these behaviours, these practices at the level of a society will mean that we have much greater resilience to similar events in the future.